Okay, we're going to talk now about the different implants available for breast augmentation. And I know that this could take a long time, but I'm going to make it really simple because you don't need to know about all the brand names, all the different things. But the main thing is that the two workhorses of breast augmentation are these two, which is a high profile implant and a moderate profile implant. And what is the difference? The difference is that for the same volume, this implant will be narrower but taller, as you can see. And this implant here will be wider and not so tall. And each one has its applications for different people. As you can see, like imagine that my hand is a rib cage that has a certain curvature. So this implant will lay in here and produce a nice curve for breast enhancement. And this one will too. And provided that they're covered with a muscle that will tighten over them, they will reproduce a very nice shape and form. These two implants can also be found in a texturized fashion. And by texturization I mean the surface is not smooth like this, but it has a roughness to it, and it does have a purpose. The main reason why I would choose a texturized implant is in case of a patient that I have any question of whether the implant is going to be moving around in the pocket, I would use a texturized implant. And so these two can be found with the texturization to them. Why would I use one over the other? And we'll talk about this one a little later. Is that most of the time I would use a moderate profile implant because it will enhance the majority of the breast tissues. Some patients with very narrow chest or a very narrow frame that would choose a larger size of implant would benefit from a high profile implant because we can get a little bigger volume in a smaller space. And especially young patients that like to have significant projection of their breast will be a good candidate for this kind. It's the choice between one or the other has a lot to do with art and perception of a beautiful breast more than science itself. And sometimes they can be used indistinctly too. Now, this other implant here is what is called a form stable implant. As you can tell, it has a certain shape to it, and what it does is it mimics what a pretty breast shape should be without much prominence of the upper portion and with some relaxation towards the bottom. As you can see, this implant is fairly round in this direction, but it has a teardrop shape in this direction. It also has a line in the middle, and this is basically a landmark that allows me to position it in a breast in the right direction. You don't want this to be in the wrong direction. And therefore, the texturization of them is because you don't want them to flip inside, so you do want the texturization to have some grip on tissues, and therefore it will not allow them to move around much. Therefore, also, this kind of implants are much more challenging in terms of positioning them because you want to position them in a pocket or space that is fairly tight, and it's just designed to fit the implant and not much else. Whereas these other implants, you can get away with a less exact or precise pocket, and you will get a good result anyways. Now, when do I use this kind of implants? I don't use them a lot because I tend to use them mostly when patients do not like their current humpy upper breast. So this will control that very effectively, and so therefore I use them mostly for revision cases. I rarely use them for primary cases. However, I'm very open about options, and sometimes patients do have that desire to consider this kind of implants, and if it's reasonable for their situation, we will be more than happy to use them. Thank you.